What would be the implications on your hospital or practice if there were a medical emergency and you couldn't communicate clearly with your patients? Have you done everything possible to make sure a gap in communication won't result in a medical or legal mistake with the Americans with Disabilities Act? There are also liability or non-compliance issues to consider. The solution to each of these challenges? LifeLinks.
I'm here with Dr. Stanley Shun, CEO of LifeLinks Video Interpreting Services. Stanley, thanks for joining us.
Good morning. It's a pleasure.
So you are a doctor by background.
That's correct.
And you started a pretty unique service, which is essentially mixing video conferencing, but also a group of interpreters around the world who can speak pretty much every language.
That is correct, yes. Say a physician or a nurse or even the admission clerk or the triage nurse in an emergency room, if they require an interpreter in almost any language, particularly sign language, but also foreign languages as well, we can bring an interpreter into the interaction in a three-way conversation, usually within as little as 15 seconds. And that is practically any language during snowstorms, on New Year's Eve, Christmas Eve, 3 o'clock in the morning, regardless. We have the interpreters available 24/7 in practically every language.
What is your name?
¿Cómo se llama?
José González.
In contrast to over-the-phone interpreting, where the interpreter is located remotely but listens to the patient speaking, in our instance, the interpreter is again located remotely but sees the patient as the patient speaks and can notice the patient's body language and infer many of the things the patient is trying to imply and transmit from the patient's voice as well as body language.
The pain is in the middle of my chest.
See. Does it get worse when you take a deep breath?
¿El dolor se empeora cuando usted respira profundamente?
In my practice, I noticed that particularly in hospitals, hospital personnel were compromising on the quality of care by not bringing in interpreters into the patient information process. And as a result of that, patients were not fully and properly informed about the potential risks and complications of their procedures. And this resulted in confusion and miscommunication and perhaps even some medical error.
And I have good news for you. The tests show that you have angina but did not have a heart attack.
Los exámenes muestran que usted tiene angina, pero que no tuvo un ataque cardíaco.
Muy bien, muy bien. I'm giving you 2 prescriptions for your heart.
It is a frightful experience being a patient in hospitals, even for English-speaking individuals. Certainly for individuals who are foreign-born and who can't communicate freely in English, it is even more frightening. And being able to see an interpreter from his or her native country makes the patient far more relaxed and become more attuned to communicating and transmitting information and becoming more trustful.
All the doctor needs is basically a laptop with either a wired or wireless Ethernet connection, correct?
That is correct. In fact, he doesn't even need a laptop. He can use something as inexpensive as a $200 video phone, okay. And he can even attach it to a television. The service is ubiquitous. It's available on practically any piece of equipment that does video conferencing that the hospital owns. We are not selling equipment. We are selling a service. We look upon it as water. It's a resource. Use it as you wish. It's available all the time. Just turn the tap.